been targeting.
I'm so sorry. I completely forgot to hit record. Such an
That's
amateur
okay.
hour. So
So
back
yeah,
over to Heather Warner on why we care about tobacco equity.
so the yeah, so I mean, I think we all, maybe some of you know the ways that the tobacco industry has targeted BIPOC communities and LGBT communities for decades. And the first image down on the bottom left is illustrates some of the early advertising. Kool was one of the first brands to target the African American community in the 1950s and 60s. And, one of the things they did was they actually showed African Americans in a really dignified way in their advertisements. They took them seriously as their market. And, and that I think added to the appeal of using the products. They we also see higher amounts of marketing and more retailers in African American communities and neighborhoods. Again, adding to, sort of that targeted marketing. We also saw support for, you see next to it, the Jazz Festival. So the tobacco industry would support events, but they also funded the NAACP with quite a bit of money. And they were really in need of funds and didn't have a lot of other places to turn to get them. So it was really attractive to take that kind of money. We also, with the LGBT community, see, the ways just recently with these, pouches and vape products, it says, take pride in your flavor. And again, you can see an emphasis on flavors and then the emphasis on LGBT community. Enjoy is a vape company, and the palm there is, just sort of enjoy LGBT is the message. The Velo message down on the bottom right is a very contemporary message about the nicotine pouches. And they've been really targeting young men, young athletes. And you can see too that it says tingle, that Velo tingle, which would indicate a mentholy, minty kind of flavor. So, and I'm going to be talking about flavors in a minute. And I will say that, the targeting of BIPOC and LGBT communities is made even worse because of the structural racism that impacts, our communities, our healthcare system. For example, Black and brown people are, used to be experimented on by our healthcare industry. And there is understandably, hesitation to trust the healthcare system. In addition, Black and brown people are less likely to be screened for, say, lung cancer or receive other screenings related to tobacco. So they may not be diagnosed as quickly and may have worse outcomes. So just a tasting of some of those equity issues.
Thank
you. So in the next slide, I'm going to grab my notes here. Just wanted to sort of show again, what the impact of these flavored products are. And again, this is another marketing tactic, and this time it primarily targets young people. So one of the things we know is that more than 80% of young people who have used tobacco products report that they began with a flavored product. And that's in contrast to adults when, who use flavored products at a much lower rate. And 97% of youth who vape, specifically vaping, use flavored products. So this is a really high appeal for young people. In terms of the flavor bans, Massachusetts banned flavors in 2020. Oh, that's not going to help. Okay, yay. It started with an immediate ban on the tobacco products, on the vape products, and then extended to other tobacco products and to menthol. But Massachusetts, not every state has flavored bans that include menthol. The U.S. banned flavored tobacco, and later it banned the e-cigarette, flavored e-cigarette, but only the cartridges. And so there's all these additives and other tobacco products that still contain flavors, which kind of allow for a lot of get-arounds in our, in our retail setting. And there's these loopholes and get-arounds include things like the tobacco industry creates these concept flavors. So for oral pouches, for example, which Ilana's going to be talking about, there's a flavor called chill, which really means minty. You know what that's what it is, but they're not saying it. And so it's kind of a get around. And fortunately, the boards of health have guidance and authority to not allow those kinds of products either. Another get around is where local retailers can hold products which they intend to sell online out of state, flavored products, and instead but what they're able to do then is, because they're on their premises, they can claim that they're sending them out of state, but really they may be selling them under the counter. So I know today they're going to be talking a little bit about how to get around that sort of loophole. And then flavor enhancers is another way that, like I said, there's not all the products nationally are regulated. And so there are these enhancers that kids are getting their hands on. So I'll stop there and pass it on to Ilana.
Thank you. And sorry, guys, somebody messaged me that the tabs were interfering. I tried to close them, and instead you all got to see my draft regulations on accessory dwelling units. Okay, Ilana, tell us a little bit about nicotine pouches.
Hi, everyone. Good evening. My name is Ilana Gurjoy, and I work for COG with Phoebe and a bunch of other great folks with the Communities That Care Coalition and Partnership for Youth. I'm just going to be talking briefly tonight, sort of piggybacking on some of the information that Heather just provided. I work especially focusing on youth health, youth substance use prevention, and youth mental health and well-being promotion. So, of course, we're thinking a lot about how tobacco is an influence on youth health and what we can do to reduce tobacco use and nicotine use. One of the things we first heard about from school adjustment and guidance counselors was the increasing use of nicotine pouches among youth. If you look at national surveys, the numbers still don't look too bad, but a lot of the surveys don't ask about nicotine pouches yet. And so the numbers are not huge, but they're definitely increasing, and there's a lot of concern about that. If you haven't heard of nicotine pouches, they're little pouches, just like in the picture. They can be held in the palm of your hand very easily. And people use them sort of like chewing tobacco. They're placed between the lip and gum for oral absorption, but they don't require any spitting. And so they're marketed as being really discreet and easy to hide at school and at home. So they're really being targeted towards youth. They also can contain flavoring, usually other kinds of fillers. And obviously there are health concerns for people of all ages. All the nicotine, concerns that we have, that's highly addictive. We still don't know about the full impact on oral health, but we do know that it can increase the risk of infections, inflammation, and possibly cancer, though they don't have the research yet because it's a new product. And there's also a lot of misleading marketing, which can lead consumers to believe that pouches are safe or that they could be used as a cessation tool. There's no data at this point to support that they are useful as a cessation tool. If someone were using chewing tobacco or cigarettes and they switched to nicotine pouches, sure, it might be better. We generally think of most other nicotine products as better than cigarettes, but it's not a safe product. It's not something for people to start using. And so we're trying to discourage it. In terms of youth, the reason that we're so concerned about that is because they're at a higher risk for addiction due to their brain development. Nicotine harms developing brains, and the pouches are really being marketed towards them with the flavors that Heather already talked about, and also the fact that social media companies are even paying companies like Zyn are paying to have Zinfluencers to entice youth. Your next slide, just about done here. Just wanted you to see how easy it is to find really high potency pouches online. And you may say, oh, but we don't see these in our local stores. That may be the case, but if a young person gets access to this really high potency stuff through an online sale, the likelihood is that then they are more likely to become addicted and try to buy something locally. And so we have a lot of concerns about this. You can see on here, if you look at it or if you get the slides after, these are all 30 to 35 milligrams per pouch. They're in flavors like strawberry, banana gum, sweet mint, and blue raspberry, and they are cheaper than cigarettes. So a can, which has 15 to 20 pouches, is under $5. Here, there's even a sale one for $4.39. And so that's really it. We have a lot of concerns about these, and I'm happy to talk more about them at any time. The last slide of mine just has some resources, which you will receive when you get the slides. Thanks so much, everyone. I'll be on here the whole time answering questions in the chat if you want to say anything to me.
Thanks, Alana. So we're shifting gears. Now this is some examples of why we are concerned about tobacco control in local public health. And the next little bit of this workshop is going to focus on who's there to help you if you want to do something about it. And so we wanted to kind of start with a little bit of level setting, that there are two categories of things. There's things you must do as a Board of Health. And that includes if a state law is broken in your town and there is evidence, there's a compliance check that shows it, you are the one that needs to issue the fine. That then gets delivered to the person. This just happened at the health department here at the FRCOG, where Meredith's group did a compliance check. We received notice. We hand delivered the letter of the $2,000 fine, and that person had to pay it to the town, and that comes into the general fund. There are a lot of more things your town can do, but you must do, and that includes passing local regulations that you're going to hear more about. And that really allows you to have a little leverage in your community and to respond to the specific needs of your community, where, for instance, you might be concerned about ZINs and want to restrict access to them in some way, or you might want to, when you create local regulations, you always create a permit for the person, which they then can lose if they don't follow your local regulations and best practices to protect public health. So that's the sort of big picture of what local boards of health role is in tobacco control. And for tonight, this sort of busy slide is, I hope, going to be helpful, because people in Franklin and Hampshire County, which most of you are, but not all, towns fall into a couple categories. Over here on the left, you've got towns that have been receiving funding from DPH through the Mass Tobacco, it's not control program anymore, cessation and control program, for many years. And those folks are served through the Pioneer Valley Tobacco Control Collaborative. And you'll see here the list of those towns. Then there are towns who are not funded to do tobacco work yet. And those towns fall into two categories: towns that are in a shared services arrangement funded by the DPH's Public Health Excellence Program. And in those within that, each town in a public health excellence grant, that arrangement had to decide what they wanted to work on. And if your group of towns decided you wanted to work on tobacco control and you're not part of the Pioneer Valley group, Mass Health Officers Association is here to tell you about what they can do to support you. If you didn't choose to work on it, there are still some things you can do. You're just not going to get quite the same level of service. And if you're not in a shared service arrangement, you also still have things that you can access. But again, not quite as much of a high level of focus in the coming year because you didn't prioritize it. So I just wanted to, I know it's a little confusing, but basically, if you don't see your town's name here, it's in one of these other categories, and that will become clear soon. And you can also just put a question in the chat. So we're going to turn it over to start with Meredith O'Leary. Why don't you introduce yourself and tell us a little about your program? You're muted.
After all these years, I still do that once in a
Hey
while.
man, I didn't press record at the beginning. You know, we're all still human.
Thank you, Phoebe, for passing this off. So good evening, everyone, and thank you for inviting me, Phoebe, to come speak tonight. Many of you know me already. My name is Meredith O'Leary, and my primary role in public health is I am the Health and Human Service Commissioner for the City of Northampton. Tonight, I'm wearing a different hat. I'm going to speak on behalf of the Pioneer Valley Tobacco Coalition, often referred to as PVTC. I've been asked to share an overview of who we are and the services that we provide as our collaborative. Before diving into that, though, I want to take a moment to introduce the Massachusetts Tobacco Cessation and Prevention Program, which Phoebe just mentioned. This is a statewide public health initiative that takes a comprehensive approach to reducing tobacco and nicotine use. Most importantly for me, MTCP, which is the Massachusetts Tobacco Cessation and Prevention Program, is the source of funding for our coalition. So the mission statement of MTCP is to reduce the health and economic burdens caused by tobacco use. This is achieved, and you can see this on the screen, by preventing youth from starting to use tobacco and nicotine products, supporting current users in quitting, protecting individuals from exposure to secondhand smoke, advancing policy development, and addressing tobacco-related health disparities. This MTCP's efforts align completely with MDPH, our Massachusetts Department of Public Health's overarching mission to prevent illness, injury, and premature death, and also to ensure access to high-quality public health services and promote wellness and health equity for all residents in the Commonwealth. So MTCP is funded by several different sources, which I don't necessarily need to get into and don't want to burden you with, but what they do with this funding is support 15 coalitions that are made up of different boards of health in the Commonwealth. And they also support 2 individual cities. So collectively speaking, MTCP funds 204 communities in Massachusetts. And again, most of them, with the exception of 2, are in collaborative, so we all work together. And in PVTC's collaborative, we have, we're currently working with 30 different communities, and we have across 3 different counties, Hampshire, Hampden, and Franklin, in Western Mass, and we have just about 350 permitted merchants that we work with. MTCP, just a few more notes about MTCP. I want to let you know that they also have 3 technical assistance providers, and some of these names might be familiar to you. Cheryl Sabara, who works with MAHB. We have Chris Banthan, who comes from the Public Health Institute, and Lisa Goodnight Stevens from the Mass Municipal Association. These, we call them technical assistance providers, but there are folks who help provide policy. They're always looking at the model regulations and enhancing and improving them, and they can provide legal guidance, not legal advice, to your local boards of health. And the last layer of MTCP is that they have 8 tobacco-free community partners, who we refer to as our CPs, who act as the bridge between the state's broader goals and the local community needs. And the tobacco-free community partners, they engage, some of the examples of the work that they do is that they engage in youth leadership programs, working with schools, and support youth-driven advocacy. They prioritize addressing tobacco-related health disparities among vulnerable populations, which you just heard Heather speak of, who is one of our CPs for MTCP. And they do much broader work, which she's happy to explain and help your community with if you're in her catchment. So this multifaceted approach ensures that MTCP addresses tobacco use comprehensively, from the grassroots prevention to systemic policy and advocacy. So then that leads us to PVTC and who we are. So PVTC is a regionally focused coalition funded through MDPH MTCP. Our mission is to reduce youth access to tobacco products and protect the public from the harms of secondhand smoke through policy development, compliance, and enforcement. The work of PVTC is critical on a local level as it ensures that tobacco control efforts are tailored to the unique needs of the communities in the Pioneer Valley. As we know, the needs of a city as large as the city of Northampton might look a little different than one of our smaller communities like Williamsburg. So having local initiatives in place is essential because tobacco-related issues such as youth access to tobacco and secondhand smoke exposure often vary based on regional demographics, socioeconomic factors, and local regulation. So by focusing on our localized efforts, the PVTC can effectively address these challenges and create sustainable changes that benefit the community, which also align with the statewide efforts. So with that being said, our structure of the PVTC is that South Hadley serves as our host community for the grant. And the staffing structure is we have Sharon Hart, who is the director of the South Hadley Health Department. She is the fiduciary agent. And then we have the coordinator, who is myself, and I'm responsible for overseeing the operations of the coalition. I act as the liaison to the local boards of health. I work on helping to strengthen local tobacco policies. I work with the MTCP technical assistance providers that I mentioned, the CPs, and I act as just kind of like the bridge to communication. I help serve and inform our community members on what's trending, perhaps some upcoming trainings, and any type of technical support that our local boards of health and or health departments may need. Also part of PVTC, we have 3 tobacco compliance officers, often referred to as TCOs. These are our boots on the ground field workers. They're responsible for the field work, ensuring that there's compliance with both the local and the state regulations and investigating any complaints related to tobacco sales and usage. This team structure helps to ensure effective enforcement and policy development at the local level, supporting both prevention and compliance efforts in our region. So that's a bit about our PVTC structure. If you want to go to the next slide. Great, thank you. So every single year I have to write a work plan for MTCP and provide it to them. Part of our work plan is, these are kind of the core functions of our work plan that you're looking at, is the first one is we provide youth compliance checks to all of our permitted stores in our catchment area. We provide 2 rounds of youth compliance checks, and if there is non-compliance, meaning there is a violation, which is a sale to a minor, our TCOs will go back and do a recheck, usually within 90 days. Youth compliance checks are a critical component of any tobacco control program because they help prevent minors from accessing tobacco products and support broader public health goals. These checks involve underage individuals going into a permitted store, trying to purchase a tobacco or nicotine product. Reducing youth access. Studies have shown that the earlier youth are exposed to tobacco, the more likely they are to become lifelong users of tobacco. So compliance checks help ensure that retailers adhere to the legal age restrictions, reducing the likelihood of underage tobacco use. So I think that's all I'm going to say. I'm trying to monitor my time, Phoebe. I can just go on about that. The last thing I do want to say about the youth compliance checks is that we have a process. Our program follows a set of standards of practice for conducting youth compliance checks. Our youth participants, of course, are under the minimum legal sales age of 21. But if they're under the age of 18, we ask for parental consent. Our youth receive specialized training through MTCP. We always prioritize their safety, their comfort level, and their privacy. We also want to maintain a supportive environment throughout the process. Our youth never carry identification. If they are asked for ID at the point of sale, when they ask for something, a product, they say that they don't have an identification. If they asked how old they are when they're asking for a product, they're honest about their age. This approach ensures compliance checks are conducted effectively while safeguarding our participants and also their confidentiality. Our youth go into any establishment with nothing but a cell phone and the money, the cash that the compliance officer gives them to go in to make a buy. The compliance officer stays in the car, but is in sight of the youth at all time. And again, the youth will go to the clerk, ask for a product. If they're given a product, they'll come back to the car. They'll give the change and the product to the tobacco compliance officer, where the tobacco compliance officer will then enter to a data system, which we call POST, all the information about the sale, the date, the time, the product, the cost of the product. Was the youth asked their age? Was the youth asked for an ID? And then the TCO will maintain chain of custody chain of that product. They'll then inform me about the details of the sale, which I then in turn provide all of that information to the Board of Health for which the town that the sale was made in and or the health department. And I will give them information in addition to the description of the sale, but perhaps how many sales have been made in the past. I'll provide them with a template letter that they can use to make it easy on their staff and any other support that they need. In return, I ask that after they send out that letter, the cease and desist letter, that there is a violation, that they send the copy that they send out to us as well, so we have that on record, and then we can go back into the state software program and let the state know what actions were taken. So that is youth compliance checks. Other parts of our work plan are inspections. Tobacco inspections are to ensure compliance with state and local regulations. But furthermore, retail inspections provide real valuable data that can inform policy development and enforcement strategies. And Ileana was talking about these oral nicotine pouches. The reason that these are now in the updated model regulations is because our TCOs, not just our TCOs in the PVTC, but TCOs across the state, about 3 years ago, really started to see this surge, this influx of these oral nicotine pouches hitting the shelves. You know, we started to see them about 10 years ago, but they only took up one little corner of one shelf. Now they take up multiple shelves of any tobacco merchant retailer. So that type of information that we provide to MTCP, again, helps drive policy work. Another component of the work that we do is we provide merchant education. Merchant education not only promotes compliance, but also strengthens relationships with retailers and encourages culturally competent practices, leading to a more effective and inclusive approach of tobacco control. Providing tobacco merchant education is essential for helping retailers understand and comply with the local, state, and federal regulations around tobacco use. We often find, you know, it's innate as humans. If we understand why something is, we are more apt to do something. So it's not enough for us to just go in, do an inspection, and write on an inspection form that there is a violation. Really providing the sales clerk and or the manager or the store owners why it is a violation and the public health implications if you don't meet compliance, what that looks like, then the less apt they are to comply. So in a nutshell, inspections and education go together hand in hand, because without proper education, retailers may not fully understand why certain actions or violations or how their behavior affects really good public health. Education helps for clarity, for compliance, not just avoiding penalties. So I'm going to leave that there, again, minding my time. So then we have the fourth component of our work, and that is really all about policy and technical support. That's what I do with, again, working with the boards of health. I support our local boards of health with providing them information about current policies and regulations and trends. MTCP comes out with model regulations quite frequently, more than we like to admit. It's hard to keep up with. And it's my job to inform our local boards of health about these policies and take a look at the comprehensive policy and see kind of what fits with their community and help with any type of amendments to their current policies. I'll provide information and templates on if they have a hearing, what the process is. I help keep our community members informed on trends and any other TA that they might, that the local boards of health might need. Currently, the MTCP just came out with another model regulation hot off the press yesterday. And so this includes a couple strategies that were earlier mentioned, like restricting the oral nicotine pouches, but it also includes a strategy about a nicotine-free generation. And that is a whole nother 20 minutes that I won't get into. But what my point is that there is a whole bunch of local strategies that you could include in your local regulation. And it's my job to work with the boards of health and health department to really kind of see what is a good fit. If you don't have a comprehensive local regulation, then I would never suggest to that community or that board of health to let's just go to the strategy of becoming a nicotine-free generation. We want to make sure that we have a comprehensive regulation in your community and make sure that it's appropriate and meets the needs of your community. Next slide.
Thank you. Yeah. Okay.
Oh, great. So part of the work that we do, let me see. I have some information that I jotted down about this. Top 4, PVTCCs. I like how I wrote that. All right. So I had mentioned to you that when we are doing our work, a lot of what we're doing is collecting data. Some of the data that we collect are the types of violations that we see when we're out in the field. And one of the first violations that we see, and these are not in any particular order, I just picked the top 4, is that a lot of our communities, our permitted merchants are missing the required signs. In Massachusetts, tobacco retailers are required to display certain signs to ensure compliance with the state tobacco laws. These requirements are part of a broader effort to reduce tobacco use and protect public health. Some of the signs that are required are the age restriction sign, smoking and vaping restrictions, health warnings, cessation products. There's a whole list of them in 105 CMR 665. And they happen to be missing more than they are there. Sometimes they're not missing completely. They just might be hidden behind other documentation that's posted on the wall. But the regulation says you must have these signs and you must have them conspicuously placed 4 feet by whatever. It's very prescriptive on how many signs you need to have and how they should be hung in your establishment. All of
I'm
these
giving you
signs.
your 1-minute warning.
Oh my God, I have so much to say. Okay, I'm going to talk really. These signs can be, you can get them at the Mass Clearinghouse, but our TCOs always have a packet of signs that they hand out to every single retailer. The second violation that we see is they're missing their Department of Revenue license and or their local permit. In Massachusetts, both the Department of Revenue and local municipalities require tobacco-related licenses and permits to regulate the sale of tobacco. So we see that quite often. The third violation is, this is kind of new. It's a requirement by MDPH that you have manufacturer letters that list that your products don't have a flavor and list that their products contain less than 35 milligrams of nicotine or less. So we look for those manufacturer letters. And the fourth violation that we see quite often is selling flavored enhancer products. And tobacco and flavored enhancer products are they come in many different forms. They can come in flavored drops or liquids, which are additives that can be added to tobacco cigars or electronic nicotine delivery systems, impart flavors like a cherry, vanilla, menthol. We see flavored papers or wraps, which are rolling papers or blunt wraps infused with flavors. We see flavored sprays, we see flavored filters, flavored capsules. We see many different types of flavored enhancers. So long story short, those are the top 4 violations. And then Phoebe, give me one more extra minute, please. I would really like you to click on that PVTC compliance sheet. This is where I keep all the data that I provide to our community members that are part of our PVTC.
Is it showing it?
It is showing it, yeah. Can you go to Northampton, the tab that says Northampton? I have a tab for every community that's part of our coalition, and this is a live document that they can go to any time, and I keep it by fiscal year, and it shows the dates that we were out in the community and if there was compliance or no compliance. And then they can, if it says non-compliance, they can hover over that and reference what happened at that date. And then if you go back to that that second worksheet page, I just created that last week. I don't remember the name of it. It's right next to the policy summary page. Yes, here is where we keep our data on youth sales, and we're doing this by fiscal year as well. If we have a community that has a rate higher than 15%, for sales to minor, then we really want to make sure that we're doing targeted education in that community, because anything higher than a 15% rate is way above the state average. So it's broken down by fiscal year, and then at the end I have it by our whole collaborative, and our average of our collaborative is right about 6%, which is really great. We'd like to see it lower. 0% is our goal, but we'll take 6% right now. We've seen a trending up in sales to minors since 2021, since COVID. So I'll end it there. I'm over time. I'm so sorry.
That's okay. You have a lot to say. You're a source of a lot of information. Thank you so much, Meredith. Okay, so we're now moving on to what if your town isn't one of the ones who gets all that services from Pioneer Valley? Well, good news. Mass Health Officers Association is here to help, and Sarah McColgan is here to tell you a little bit about that. And this is to kick us off. This is the list of the collaboratives in Western Mass who have identified this work as a priority for them. So if you're in one of these, then we're talking to you. And that is, from what I know, most of you. Okay, take it away, Sarah. What can people expect from MHOA?
Thanks, Phoebe. If you are one of those in one of those collaboratives, as Phoebe had said, MHOA has an expanded contract with the Department of Public Health, MTCP, to provide tobacco services in a way that will help increase your municipality's capacity to do these services. There may not ever be a time that there's full funding unless the SAFE 2.0 bill comes through and gets funded, but MTCP itself may not be able to fund you at any point in the near future. So we'd like to help municipalities get to the point where they are able to do as much as they possibly can on their own. And some of it is very easy and very kind of obvious and in front of you. So if you're one of those towns in the shared services that is not funded as part of Meredith's program and has identified tobacco, these are the types of things that MHOA has available to you. And I'm just going to highlight a few of them. We have training on conducting retail tobacco inspections and conducting compliance checks. Along with the kind of theoretical training, there's also a ride along available so that you'll go out with our inspector trainer who is on the webinar today and do a ride along in a group of maybe a few other municipalities and go into maybe 3 or 4 stores and learn the nuts and bolts on the job as far as what you're going to be looking for. And I think when you're doing that, you're going to see the ease that you could incorporate tobacco into your existing inspections, food service inspections in particular. So that's one of our goals, is that tobacco get incorporated. Also, Meredith talked about revising and updating regulations. MHOA does not provide any policy TA anymore, but as Meredith said, there are 3 attorneys who do: Cheryl Sabara, Lisa Stevens Goodnight, and Chris Banthen, and they're going to be conducting workshop sessions in groups virtually to help municipalities revise their regulations. The first session is tomorrow. The next session is Monday, and then they have another one January 6th, and subsequent sessions will be scheduled after that. All of the training sessions, whether it's retail tobacco inspection or the help in your regulations, you can register on the MHOA website. I'm going to be conducting, can we back up quick? I'm going to be conducting monthly office hours to discuss new trends, new products that folks are seeing, that people who are out there all the time in the field that work for Meredith and the other programs are seeing, enforcement issues and things like that. So those monthly office hours will also be advertised through MHOA, and all of these things are going to be advertised in the MHOA newsletter. If you don't get the newsletter now, go on the MHOA website, scroll down a little bit on the front-facing page, and there's a spot there to register for the newsletter. So monthly office hours coming up. In municipalities that don't believe that they're going to have the capacity to do inspections or do compliance checks, MHOA will do those in your community if you've requested it. This year, FY25, we're focusing on inspections because the year is half over and we're just gotten things rolling at this point. FY26, we're hoping to do inspections and compliance checks for all the municipalities, and it's quite a bunch. We've got requests for about 350 inspections and 675 compliance checks. So there's a lot out there. I will also do group retail training for store owners. Needs to be a group of at least 5. I do it virtually. If you don't have 5 store owners in your town that might be interested, maybe you can buddy up with your neighbors and come up with 5 store owners, and we can do that training for you. And then technical assistance on non-legal issues is something that I continue to do. Anything that's a legal issue, again, I'm going to refer you to either Cheryl, Lisa, or Chris. Next slide. If you're not part of a shared service agreement or you didn't prioritize tobacco in your work plan, MHOA can still help as always. Training, all the trainings are available to anybody. Monthly office hours are available to anybody. The group training for the store owners and the technical assistance. You just won't get the actual boots on the ground conducting the inspections and compliance checks. Next slide. So these are the towns in Western Mass that currently don't issue permits to tobacco vendors. Now, some of these towns don't have any tobacco vendors, so obviously nobody to issue a permit to. However, some of them do, and there are advantages to issuing permits to tobacco vendors. So I can certainly work with you on understanding that, work with your board on understanding that, and hopefully put in a permitting process, which is very easy. But I just wanted you to kind of see a lot of small towns in the Western Mass area, and a lot of these towns don't even have any stores, retail stores. These are some of the upcoming trainings: tobacco regulation information training, which is overview of the new model reg. As Meredith said, it was just released yesterday. It gets revised often, but that doesn't mean that every time we revise the model reg, you need to revise your reg. Sometimes it's just a new definition's been added. Sometimes it's changing the wording on a sentence. So it's nothing to panic about the fact that lawyers are revising it constantly. The monthly office hours, 3rd Wednesday of each month, December 18th, I believe, is the Wednesday this month. Retail tobacco inspection training. We've held 2 of them already. The 3rd one is going to be on the 29th of January. We will have more in between then and April 30th if there is a need for it. Merchant education training is very important, and that's something that Casey, our trainer at inspector, is going to be working with folks on, so that you understand what sort of information is available for you to provide your merchants. Remember, compliance is our goal, not fining them and suspending them. Complying with the regulation is our goal. So we like to give the merchants as much information as we possibly can to help them comply with the regulation. So we're going to be offering that a couple times. And then towards the end of the fiscal year, I'll be doing a training on incorporating tobacco into retail food inspections. We offered that at the MHOA conference, and we'll kind of revise it a little bit and offer it again. But there are a number of other trainings. Contact hours are provided. You register on MHOA.com. And I hope everybody, if you haven't been to the tobacco page, that you look at the tobacco page on MHOA.com. There are, you'll see a little banner called guidance documents. And before you contact one of the TA providers, look there. I bet the answer to your question is there. How do I know if something's flavored? How do I conduct a sniff test? How do I conduct a hearing? What should my board chairman be saying at a hearing? All of these things are there in a guidance document for you. And again, it's guidance, it's not legal advice. Thank you. Think I turn it back over to you,
Oh,
Phoebe?
yes, you do. Okay. Great. Well, thank you. So this was your little sampler of what to know, depending on which kind of Board of Health you're in, which category, what's available to you. We hope that if you're interested in following up on any of this, you will reach out to Sarah or Meredith around the enforcement stuff. And if you want to talk more about impact on youth, or the history of the targeting of BIPOC people or LGBTQ people, you'll reach out to Alana or Heather. We encourage you all to read up on nicotine pouches and flavored tobacco and be on the lookout when you're out and about. It's surprisingly large amount of flavored stuff still findable, as Meredith said, and the pouches, unless like me, you have a young person in your life in their 20s, you may have never heard of these pouches. We encourage you to do a little more self-education, reach out to any of us for help. And in particular, if your town doesn't currently have tobacco regulations and you'd like some help, it's not for the faint of heart, and they really do want to help. And in fact, there's lawsuits almost every week getting, adjudicated. And so we strongly encourage you to reach out to a technical service provider. Don't try to just find one on the internet or take the next town overs and work with it. Folks here are paid to help you with that, and they're happy to do so. I think that's everything on our list, and this is how you can get in touch with people. We will definitely send the slides out to you, and all the materials that have been shared in the chat, and you will get this in your email tomorrow, and a link to a web page to find it all. We do have 4 minutes until we're done, so if anyone has a question, you are welcome to unmute and ask it. And if not, you will get all the follow-up in your mailbox. I'm going to stop sharing and also stop recording.